Thank you very much for the invitation to give this presentation. I do quite a lot of teaching for different groups, including veterinary students, but also ECDC course participants, One Health course participants, different groups from all over the world about exactly this topic. How we can link One Health, how we can think of One Health in a way that contributes to planetary health and sustainability of our society and the planet in general. So I'm going to give you some of the insights that I'm also giving these people. So of course you know the world is changing and so are the challenges we're facing. Now we are more than 8 billion people. I still remember when my parents were almost freaking out about how we reached 5 billion when I was a child, and yeah, this is how it's going. So how can we feed the world sustainably, and how can we live sustainably in this world? Our consumption patterns are also changing rapidly with the growing population, and this is pretty much anything we look at, whether it's transportation, fertilizer consumption, paper production, plastic production, water use, energy use. You know the picture. It just keeps growing with the growing population and the growing wealth of the population. So this also, of course, has an impact on the planetary health. And these are just some of the aspects. The biodiversity, how we are capturing fish in the sea, the CO2 emissions, ocean acidification, and losing tropical forests. And it's clearly linked to the population growth. So I also always ask when I present this figure, how many of you know about the planetary boundaries? Please raise your hand. So this is really interesting because it's always somewhere between 0 and 50%. And I think here we are maybe around 20-ish%. So that's good. I'll try to give you an insight here then. It's work that is created by the Stockholm Resilience Center. And this is a group of international researchers who are collecting, these are Earth science system researchers. They are collecting data, so it's really evidence-based. They're trying to collect all the data they can continuously, and they have identified these 9 processes that is keeping, if they are stable, they are keeping the planetary health stable and safe for all of us. So they say there is this zone here, which is a safe operating space that we should stay within. And then they have identified these 9 boundaries, they call them, or processes that are on our planet. And this is, it's very hard for me to see this actually, but it's, so let's start with the ozone layer. We know that back in the 80s, people got really worried about how we were seeing this big hole in the ozone layer growing and growing. And then there were international legislation put in place so that we would stop putting so much freon in the atmosphere. And today we are actually managing to stay below this safe operating space, even though the hole is still there, but it's not growing like it did back in the 80s. And we also have the air pollution, you could say. I'll put this up here, maybe, yeah, sorry, here. Yeah, so the air pollution, particles in the air, this could also be dust. It's growing, this is globally, it's growing. Of course, in some areas, locally, this is a huge problem, and in other places, it's not a problem at all. But it's also moving up towards this safe boundary. We have the acidification of the oceans, which is also closely linked to the climate change, actually. And it is also growing closer and closer to the boundary, but we are still not exceeding it. However, phosphorus and nitrogen, these salts that we are emitting or releasing into the environment is hugely overshot on this boundary here. And the way we are using the fresh water, both for drinking, but also for making it available for plants, is also exceeded now. And so we are reaching some areas that is not safe for our planetary health. And we can actually reach tipping points if we keep pushing these boundaries. So the land use and the cutting down of forests is here. And we have the biodiversity, functional and genetic. And we have the climate change that we, of course, hear a lot about, and the CO2 emissions, and the heating of the planet. And then the last one that they put numbers on and actually try to quantify is the novel entities or risky synthetic compounds that are put into the environment without being properly assessed for the risk that they are causing to our planetary health. So we have these now 9 boundaries that are now continuously being monitored, and there are all the time or regularly papers coming out saying where we are on these boundaries. So what they also say at the Stockholm Resilience Center is that sustainability must be reached at the absolute scale. So it's not just enough to say we can do a little bit better here. We really have to try to get down back in this green space for us to know that the planet will sustain in the long run in a way that we can live healthy on this planet. I mean, the planet will still be here, but it may not be a nice place to be. And of course, and also that sustainability means that we must reach these boundaries or stay within the boundaries, all the boundaries, not just climate change or greenhouse gas emissions, which is very much the focus at the moment. What they also say is that it's probably not very likely that we can do this by increasing productivity relatively. So saying that we can produce more with less is not going to make us manage to stay within the boundaries or even move closer to the boundaries here. So because very often it has rebound effects. So for instance, if we make our cars cleaner, we tend to drive them more, they become cheaper, and then we drive more. So we have this rebound effect where even though we actually have nicer cars and cleaner cars to drive, we still emit as much by driving them more. So this is just one example, and you can probably come up with others from your own area. If you find this difficult to perceive when I'm talking about it, I really recommend that you listen to a podcast from Niras, Den Grønne Sofa, which is a PhD student who did a PhD about trying to stay. I mean, how can we reach this absolute sustainability within the building industry? But it doesn't matter. We can all use this way of thinking, I think. And there's now also at DTU a Center for Absolute Sustainability, which is actually trying to work with how can we obtain this. Also now, the Lancet is acknowledging planetary health, and I think that some of these statements that were in a paper back in 2015, saying that we must change our lives so that it will be possible to live by the contrary assumption. The contrary is to this up here, that what was good for us would be good for the world. By the contrary assumption that what is good for the world will be good for us. So we really have to think about trying to make the planet a better place to be, and then we will feel better as well ourselves. So simply put, planetary health is the health of human civilization and the state of the natural systems on which it depends. And as you can see, they try to illustrate this saying, well, we are with One Health very, very close to what they consider planetary health also. Of course, we are considering very much the animals and the humans and the environment here, and not so much the planetary processes as such, but maybe we should. Wrong way. So this is I would say, a positive development in the conceptualization of One Health. Back in 2017, the definition that WHO had was very public health oriented, whereas today the new definition that is out from the One Health high-level panel is much broader in the scope. I'll show that, which also all the time acknowledges we have these different domains we have to address, we have to collaborate, we have to build capacities, we have to communicate and coordinate between all of these sectors and disciplines, and at all levels of society. So that definition, which came out, is now supported by WOA, FAO, WHO, and UNEP, so all the domains, and yeah, I'd actually like to read it out. One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems. They are closely linked and interdependent. And then the last bit is actually the newest part. The approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems while addressing the collective need for clean water, energy and air, and safe and nutritious food, taking action on climate change, and contributing to sustainable development. So we can see now that the planetary boundaries is actually in the definition of One Health today. So I think we need to think about that when we are doing research or acting in general in the One Health arena. Of course, the sustainability development goals have been there for quite a while, and a lot of people are referring to these as part of the sustainability agenda. And what we see more and more, I think, is that, for instance, when we do research, we tend to point, and we even ask sometimes to point to which of these goals are you then contributing to. And of course, a lot of us would be pointing to two. So we are trying to alleviate the problems with hunger, or maybe good health and well-being here, or some of the others. But what we are never asked about is, well, are you doing any harm to any of the other goals at the same time? And I think you can easily see that this could happen. I mean, we can easily produce more food, but we may be harming our water or the sea or a lot of the other things. So I think that is one way we can maybe try to think differently about it. Can we both improve some of these or contribute to some of these goals, but also make sure that we don't make it more difficult to reach some of the other goals? And there is actually in the newest report from the Sustainability Development Goals report from last year, they are actually saying that it is not going the right way with all of these goals, and that some of the crises that we had with COVID-19, but also climate change and different conflicts around the world, is creating some spin-off impacts on food and nutrition and health and education and environment and peace and security, so that some of these goals that we are trying to reach are harmed by the way we have acted to some of these other crises. So we really need to think about the whole picture every time we take action. Okay, so I'm going to move a little bit into the food production side. We are using quite a lot of the land. That's also what the planetary boundaries framework was saying. We're using quite a lot of our habitable land for agriculture, and most of that, about 77% here globally, we're using for livestock, dairy and meat production, and about 23% on crops. But when we look at the calorie supply and the protein supplies, what we get out of it from the livestock sector is actually not as much as we get out from the crops. So we probably need to change the balance here. Also for other reasons, when we are pushing these systems or these land use systems, then it leads to biodiversity loss. And here you can see that today we only have about 4% of the total biomass left in the world, which is wild animals. And then the rest, we have a lot of livestock, and of course we are also taking up a lot of space ourselves. So that's part of the reason why there's a push for more plant-based diets, or a shift in the way we produce. And farming does have a lot to do. This is another paper that has related to the planetary boundaries, tried to put numbers on how much of this exceeding of the boundaries are caused by farming practices. And they say that these dotted areas here is where farming has contributed. So quite a lot of those, this is an older paper, so we don't have the novel entities and the air pollution yet, but it is, you can see that those that were overshot at that time are definitely to a large extent driven by the way we are farming today. So sustainability in livestock production is not just about environment. So we talked a lot about that so far, but it's also, of course, it needs to be economically viable, but it also needs to be socially responsible. So there are ethics, there are animal welfare, there's mental health, there's working conditions that need to be considered inside the topics of sustainability. So somehow we need to try to find a sweet spot here if we want to produce livestock. And this idea has also been taken up by the Wellbeing Economy Alliance. So they're saying, well, we have the planetary boundaries on the environmental side, but yeah, it's very easy to live up to not polluting too much if we don't eat or breathe or almost think, right? I mean, so we can, here they say we should not overshoot the planetary boundaries, but at the same time we should have a good social foundation. We should have access to education, good health, work and income, peace and justice. We should have a political voice, social equity, equality, gender equality, housing and good social networks, access to energy, water and food. That's part of the social foundation. So somehow we need to find a balance where this is going well, but we are not overshooting on the planetary boundaries. And Kate Raworth is an economist from UK who's done quite a lot. She calls it donut economics because we need to try to stay within these two rings here. So that's the donut. Safe and just operating space. So there is a group from Leeds that has tried to put numbers on different countries, and you can actually go and if you're not from Denmark, you can go and find your own country and see how it has gone over time. But here's Denmark. And how are we doing? Well, so this is from 92 to 2007, 2015, and you can see that, well, it looks quite a lot the same, but we have, for instance, got a lot more CO2 emissions over time. So we're overshooting more and more on that. Whereas the phosphorus here has been quite bad back in the 90s, but we've done something to reduce that, but we're still lacking to work on these different boundaries here. At the same time, Denmark is doing very well. When it's all blue in here, it means that we're doing very well on the social foundation. And they have done this for many different countries, and there are actually countries. Unfortunately, it's usually like this, you know, if you have a country with a very good social foundation, then they are also overshooting on the planetary boundaries. But there are countries who are doing much better than we are and still have a good life. For instance, Costa Rica. That's one of the countries that are okay here, but still not overshooting completely here. So maybe we can learn from some of these countries, what can we do? And definitely one thing they are doing in Costa Rica is to make sure that they conserve their nature probably better than we have been doing. There's the whole issue about sustainability in livestock production, why it's important. And it's important, of course, because it is itself challenged by climate change and by these increasing farm intensities that are leading to resilience problems or vulnerable systems that are out of balance in some cases, or that resources are becoming less or not consistently available for the animals, feed, water, and so on. We also have the issues with the emerging diseases and disease outbreaks, and of course antimicrobial resistance. So it's challenged in itself by these issues, but it's at the same time pushing these issues. So it's accelerating the climate change and the water and resource depletion in general. It's leading to deforestation, monocultures, pesticide, antimicrobial use, hormone use in some areas, and loss of biodiversity. And in general, accelerating emerging and zoonotic infections. So, and then there are the welfare issues. So in general, these things are very tightly linked, and that's also what FAO is pointing to. They're saying there is this kind of circle. It can be an evil circle or it can be a good circle. Right now it's probably a bit of an evil circle that we have deteriorating animal health in some areas, which is then accelerated by climate change, and then we get this problem here with heat stress, droughts, floods, fires, and so on in some areas of the world. And of course the public health concerns. So very often what we see suggested as solutions are technical solutions or technological fixes that are mostly used for conventional or intensive farms. So this could be improving the feed conversion ratio so that we can produce more with less, essentially, or increasing the production per animal, or breeding for reducing methane emissions, or better feed conversion, I already said that, feed additives to reduce the methane, or we can put vacuum extractors on the hoods of the barns to try to remove the methane, different types of manure handling, but also the way we are using antimicrobials or vaccination or biosecurity and so on. It's also part of these technical ways of sustaining the livestock production. And I'm looking at it this way, that you can look at it as kind of optimization over time. So if you look at it maybe 20, 30, 45, 50 years, you'll see that what is happening is that at least in Denmark, the livestock production is growing and we get more and more intense farming, and that in some instances lead to infections that are spreading, or maybe even new infections that are spreading easier. So we want to do something about this, and what we could do is maybe develop a vaccine or use antimicrobials to stop the animals from getting sick. And then in that way we end up actually helping the farmers, it makes it easier for them to have more intense farming. So over time, we may be thinking that we are helping them, but maybe we are actually helping them get into this vulnerable situation. And we do that through what we're doing at the universities or these types of institutions that are gathered here today. We increase our scientific knowledge, and then we help develop new tools or surveillance or whatever, and actually kind of become part of this feedback loop. So it can also sometimes lead to zoonotic mutations, as you know, pandemic risks, AMR in some areas, public health and animal risks. So I sometimes ask myself, are we really part of the solution or part of the problem? And I think this is quite hard for me to think about, but I do think we need to think about it. Because it leads to lack of trust and financial instability, so it's not sustainable. And there are definitely lessons that we can learn if we look at it over time and start to think about it when we make decisions. And just an example from my own world, I've been working for 23 years now with the Salmonella Dublin program, also worked with other things, and I was actually kind of hoping that I didn't have to work with Salmonella Dublin anymore when we reached the lowest point in 2015, around here, when the prevalence, the national prevalence is the black line. These are regional prevalences, but the black line is the national prevalence, and we reached the lowest point around 5.5–6% infected dairy farms. But then it slowly started creeping up again, and now we are up around 11.5. So why is this happening? When we have we know what should be done. We have a very, very strict surveillance program and control program where farmers are not allowed to move animals to other farms when they are test positive. Yeah, I think I had to kind of lift my eyes up and look into the horizon and say, what is going on? And it's quite likely it has something to do with the structural development in the Danish dairy sector, because the herd size is growing really dramatically, and the number of farms is dropping at the same time. So we have around the same number of animals, but they are grouped together in herds that are quite big. They're also moving. We have more multi-site farms, so they're moving the animals around a lot more between their own farms. And of course the production has gone up. They are using heifer rearing facilities a lot more, so this movement of animals make the system more vulnerable to spread of disease. We also have an increasing proportion of, or we had an increasing proportion of organic farms, not so much anymore. And that's one factor. The other factor I would say is the human factor, that biosecurity becomes more and more important. When you see this picture, there's nothing more important than really having biosecurity in place. And, but it's not something that is thought of as an interesting topic. And it's hard work, it's manual work a lot of times, and it's annoying, it takes the speed out of the daily work and so on. And we did an interview, there was a master thesis student from Ukraine who could speak with Russian and Ukrainian speaking employees, this was in pig herds back in 2019. And she found that there was a lot of room for improvement also in the Danish pig farms, about hygiene, medicine use, and practices in general that has to do with animal welfare and biosecurity. They want to know more, they need more education, but it's not happening. So we do have an issue with the human factor also. So some of the other proposed solutions that we have seen have been that to make them more nature-based, to kind of bring the animals back into the nature, you could say, and use the principles of redirecting, regulating, and regenerating. So the whole regenerative type of agriculture are what other people are suggesting. These can be holistic grazing systems, or where integrating forests or into the systems. They can be more mixed types of productions, and it probably leads to more resilience to pathogens and less spread of pathogens in general, and also makes them more resilient to climate change effects. And this is relevant because actually 70 to 80% of our food that are consumed is produced in small holdings in the world. So elsewhere, they might actually need to know more about regenerative production than about the very, very intensive production that we have in Denmark. But we kind of like to tell them, oh, you should just do what we are doing. I'm not sure. Okay, so I think we need to think in systems. And you probably know this one, where what we are seeing is kind of like the iceberg model here. We're seeing the events, we are handling the events. It could be a disease outbreak. We also collect information about the patterns of events over time and try to understand that. Epidemiology, surveillance, all the things that we are doing in this group. But there are some systematic structures underneath these behaviors or these patterns that we also need to try to understand. And what is leading to these structures is mental models or values, traditions. Why are we doing the things we are doing? Why do we have the systems we have? This could just be something like our tax system. Any system you can think of is really created by some way of thinking. So in our group here, in our One Health arena, I would say that we are in today, we work a lot with outbreak investigations and management of outbreaks, contingency and risk assessment, of course, and surveillance and epidemiology, and aiming to be prepared for whatever could happen. So we are working a lot in these two layers, I would say. But how much work are we doing here? How much are we doing to try to improve our understanding of what is going on? And using that also to feed that up. Are we doing enough transdisciplinary research and innovation? Are we asking the right questions in our research and in our contingency maybe also? What are the values of the Danish One Health arena? All of you who are here, who are working with One Health, what are your values? How do you see this? What do you think we should do? And what are the values in DK-Vet, for instance, the One Health Consortium? I looked into the, it disappeared out, didn't it? Well, I looked into this this document that is describing the DK-Vet, and it says a lot about what are the duties, the responsibilities, who does what, who's leading what, how is it organized, what agreements do we have in place, but I could not find a single word in there about values. Where's the description of the mindset that is required for a One Health Consortium and the collaboration agreement that really needs to work with using real One Health approaches, I would say. So maybe we can discuss that today. We have a lot about here. We're doing research-based consultancy. We are doing research-based surveillance. We're doing research-based contingency. We're doing research and general development of competences and capacities. So maybe there's something here we can do in terms of these values, working on values and systems thinking. So I'd say maybe we should think about One Health. It's not just multidisciplinary. We need to move away from this way of silo thinking and planning and working, where we have collaboration, yes, but do we have enough collaboration? And do we have enough synergy between what we're doing? So work much more towards identifying some common goals that we need to solve together with all of our competences. And this, I acknowledge that it doesn't just require our disciplinary knowledge. It also requires social skills, emotional skills, leadership, critical thinking, and collaboration, communication, and so on. And there's actually a paper out, if you want to have a look at that, that says something about how we should try to develop our One Health competences more. Yeah. So what helps One Health work in practice? I think very strong leadership to support the One Health approach. And this also means the mindset of those who are leading, right? That we have the right actors, or the actors with the right attitude in place, that are working towards common goals and not personal gain. One Health is not about, actually most of you who are here are not here for personal gain. You would be working in Novo Nordisk, so. But so why not skip it and then just try to work with really thinking One Health is where we can contribute to a sustainable world. Our engagement and participation and understanding of the common goal is so important. And of course, talking to the stakeholders in the initiatives. And then trying to avoid competition and hostility between institutions and people. It's so important for One Health. Of course, funding that supports One Health. How can we try to do something that will improve our situation about how we can work? And making sure that we have structures in place that promote this way of thinking and working. And this could be that we may have to have more exchange of workforce because it creates better understanding of each other, more center structures and more structures of shared data and knowledge and experience. So really learning from each other. And then we also need to be able to evaluate and adjust initiatives. So not just think, okay, now we have an idea where we are going and then we just do this until we're done. We really all the time have to think about how we can evaluate what we're doing and how we can change it, if it needs to be changed. So communication, I don't know how many times I put communication, but I think it is so crucial. And sharing knowledge and evidence, mutual respect, learning infrastructures, and so on. And then maybe think about sometimes asking new types of questions. We are so used to asking the same types of questions, but maybe we need to look at it from a different perspective. For instance, thinking about the way we're looking at the sustainability development goals. Okay, so we want to solve this, but what effects could it have on something else? Maybe we need to include those questions as well. I'm so lucky to be in a new project together with some anthropologists, and that has completely thrown me off chart for about a year. They are asking so many questions I've never ever been asked before after 3 years as an epidemiologist. We cannot do that. We have to have these questions along the way. So, and that requires that we open up and start working with these people. So this is it's about cattle production, and we're looking at alternative cattle production sites. And also, as one of the things, we are looking at materialities inside the livestock production, and we have now created an exhibition. So my last words is going to be, come visit us in the new exhibition, and then we can maybe talk about livestock and how it has developed over time, but also talk about what type of questions should we be asking, how can we collaborate better, and learning from each other.